There is new hope tonight for children born with a genetic skin defect. It causes their skin to blister and peel off at the slightest touch.
CBS 2's Dr. Max Gomez tells us that stem cell scientists are getting close to making new skin for these kids.
At first glance, it looks like 8-year-old Jackson Silver is getting a little ice cream treat after lunch. But a closer look shows Jackson's hands are blistered, so are other covered parts of his body. And the ice cream treat is to soothe similar blistering in his esophagus. Jackson was born with a genetic skin disorder called epidermolysis bullosa, EB for short.
There's proteins missing, collagens and others in the skin that cause it to blister with the slightest touch, and in many cases that blistering heals with lifelong scarring.
It also means Jackson is vulnerable to terrible infections, so his parents have to put him through a daily hour-long ritual of soaking his wounds and bandages, treating blisters and rebandaging. Jackson claims it doesn't hurt. Does your EB hurt?
Well, only when I have a boo-boo.
But his parents know better.
It's just an awful position to be in as a parent, to have to cause your child pain on a regular basis to make sure he is cared for the way he needs to be.
EB also means Jackson can't do sports or play with friends the way other kids do. It also means that kids with EB often don't live past their 20s.
I really don't think about it. I don't let myself think about it. And we don't talk to him about that.
What the Silvers have done is form the EB Research Partnership, funding a groundbreaking consortium at Columbia, the University of Colorado, Denver, and Stanford University. Researchers take skin cells from EB patients, convert them into stem cells, then they use new gene editing tools to correct the defect in those cells. Then they multiply the stem cells, convert them back into skin, and graft the skin onto EB patients.
You're starting with the patient's own cells, so there's really very little chance, if any, that they'll be rejected.
And that's what may one day soon give Jackson the normal skin other children take for granted. Now, all of the steps in this stem cell process have already been done. Now the trick is to put them all together and show the FDA that it's safe and effective. Those trials are a little ways off, but they are in the works. And if this works for EB, the same techniques could be used to correct all sorts of genetic defects. So it's stem cell science, genetic engineering, all coming together to help these kids. It's really interesting.
Nice combo.
Yeah, sure is.
Oh, hope for the best. Gotta have hope, though, right?
Always have hope.
Thank you.
You bet.